Hi, this is Haley Boyko, and I'm going to be talking about 3 common injuries in the sport of cross country. So let's get started. Okay, so the first one is the iliotibial band syndrome, and this is actually the most common one for knee pain in runners, for lateral knee pain to be specific. So it's just an overuse of the connective tissues on the outside of the knee, and it results in swelling of the tendons surrounding the iliotibial band, and then that photo shows where the IT band is and the area of pain, which is on the lateral side of the knee. So this syndrome can be caused by running on a slope for long periods of time, which is super common in cross-country races. Leg length differences of the runner, which isn't uncommon at all. Poor foot structure, excessive shoe breakdown, so not switching out the shoes at the recommended time, training intensity errors, muscle imbalances, or poor running mechanisms. So anatomically, the IT band is a thick band of tissue that originates at the iliac crest, goes through the outside part of the thigh, and crosses the knee to attach into the tibia. So there's actually a bursa or a tendon that allows for smooth movement of the IT band, and the syndrome is defined by inflammation in this area, so of the bursa. So, in leaving this untreated can decrease knee range of motion in the runner. And the test that I looked up to see whether or not someone has this syndrome is called the Ober's test. And this is defined here, and I'll explain. It's when the patient lies down with the unaffected side down, and the unaffected hip and knee is at a 90-degree angle. And if the IT band is tight, the patient will have difficulty adducting the leg beyond the midline, and it may experience pain at the lateral knee. So that's a good test for this syndrome. The second one I looked up is super common that we've all heard about before. It's the ACL tear. So this can be caused by overstretching or tearing of the anterior cruciate ligament, which is in the knee, and it could be a complete or partial tear. And the photo I have right there shows the difference between a normal ACL and then an injured one, and you can see that the injured one is torn. So this can be caused by pivoting incorrectly while running. So, like for example, suddenly slowing down and then changing directions really quick or stopping suddenly. And then a fun fact about an ACL tear is that women are much more likely to get it than men because women are quadricep dominant rather than hamstring dominant most of the time. And for men, since they do have those stronger hamstrings, it stops the shin from moving in an incorrect way, which can cause the tear, whereas women don't necessarily have that benefit. Anatomically, the ACL is one of the 4 static stabilizer ligaments of the knee joint. And like I said before, it's caused by overuse or misuse of the knee joint. And for the assessments for this, I looked up 2. It's one of them's anterior drawer test, which is an orthopedic exam of the knee, and the second one is called a Lachman's test, which is a pivot test. And these have both been proven to be more accurate than the MRI, which was super interesting to me. And then the last injury I'm going to talk about is called the piriformis syndrome. And this is a condition in which the piriformis muscle, which is located in the glutes, spasms and causes pain. And it could actually go down the runner's thigh into the back of their knee. So this is caused by overuse and strains from running that in turn create inflammation. It could be caused by trauma or scar formation. Anatomically, the piriformis muscle is flat and located near the top of the hip joint in the buttocks, like I said. Um, so, and this syndrome is caused when the muscle compresses with the sciatic nerve. So, oftentimes this is mistaken for sciatica, which has to do with the sciatic nerve. So, the sciatic nerve goes through the piriformis muscle and actually goes all the way down to our feet. So spasms of the piriformis create nerve compression of the sciatic nerve. So these work hand in hand in this syndrome. Um, for the assessment, the sciatic nerve issues are tested by like clinical history of the patient and orthopedic assessments. And the piriformis is determined to be the cause of the patient's sciatica. So it's just to see if those two are working hand in hand to create an issue. And then here are my links and my resources. So thank you for watching.